right, welcome back to Knife After Death. This is episode 3 of Corpses and Cadavers, part 2. I am Dr. Darren Wolf. I am a board-certified forensic pathologist slash medical examiner. And basically, we're going to continue our discussion from last time, which was about cadavers. And of course, what I'm trying to do is impart upon you what the substance of death is like. That's what I call it, the substance of death, the many forms that we find the body in that we can, that I can impart upon to you what I see and what I feel when I do an autopsy. So I wanted to start this episode with just kind of a look back at the last one. And that is, we talked about cadavers. Cadavers are mainly used for anatomical dissection, for learning and learning normal. Whereas when we talk about corpses, we're thinking about autopsies and learning about the abnormal. So all fields of medicine kind of have this motif where you need to learn normal first before you learn abnormal. And that's how most medical educations are structured. That's why all doctors of any type of school in medicine usually have that, where they learn the normal first and everybody's kind of on the same footing. And then as we get into our clinical rounds, we start to learn more about the abnormal. And so that's basically what we're talking about here, is that the cadaver it's pickled, it's been fixed in formaldehyde, it's firm. Even the word sounds hard. There was cadaver, the hard consonants there, versus the corpse, which is, by definition, it's a fresh body that's may or may not be in different levels of decomposition. When I speak of the corpse, of course, I could mean both, but for the most part, I'm talking about the freshly dead, somebody who's only been dead for a day or two, and then you perform an autopsy. We will talk more about the other substances of death, which would include decomposition. That's going to be the stage past the corpse. Now, a decomposed body is still a corpse, but it has a different feel and definitely a different smell. And we're going to talk a lot about decomposition on this podcast, but I don't have those episodes slated immediately. We're gonna do that a little bit later when we talk about some more basic stuff, and then of course very late decomposition, where what we have left is mainly bones. So this would be almost like a forensic anthropology type thing. There is some overlap between what I do and then when we bring the forensic anthropologist in to look at the bones and make determinations. So we'll definitely do episodes on that as well. Before we get too far into today's episode, I wanted to answer a couple of questions generated by the last episode. Now, this is something I might do in the future, where I start the new podcast kind of addressing old issues, or I may aggregate the questions and comments and do a mini podcast episode where I simply address these many questions or comments that I get. Unfortunately, I get lots of questions and comments. And by the way, not unfortunately, but the unfortunate part is I can't answer them all, because I would spend all day just answering questions if that's what I had to do. So the first question is kind of funny. Somebody said, actually multiple people said, of Corpses and Cadavers, did you kind of take that as a play on Of Mice and Men, which is a novel by an author named John Steinbeck? Many of you probably read it in high school English or something. And that book was written in 1937. The truth is, I actually love that book. That is one of my favorite books. And on subconscious level, I probably did take Of Corpses and Cadavers from that Of Mice and Men title. But certainly, I think mine sounds a little more interesting. The second question was, and this is great too, because these are from the people who are listening through Apple, through iTunes. Had people message me somewhat panicked and saying, Dr. Wolf, it starts at episode 2. Where's episode 1? And I have to tell you, nothing makes me more upset than something that's misnumbered like that. But what happened was when I uploaded the initial podcast, it was in the wrong format for a couple of the sites that I do podcasts on, which would be Google and Spotify. And so what I had to do is I had to delete the first one and upload a new one of the correct format. And what that did was it got the numbering off at Apple, but nowhere else, because Apple will accept the original format that I had put it in. So it took it as I deleted an episode. Um, maybe I would have liked to have been more mysterious and said, yes, there's a secret episode out there which only certain people can hear. But unfortunately, I'm not that cool. Maybe I'll do a special one just for Apple listeners to kind of alleviate that angst from seeing the podcast start at episode 2. Or number 2. It actually started at episode 1. So for Apple listeners, you have not missed anything. Don't panic. Now, one correction I wanted to make from the last podcast was when I was talking about dermatologists and other doctors back in the old days performing autopsies, because now it's pretty much just pathologists and mostly forensic pathologists. But I had mentioned that back in the old days, there were doctors, even like dermatologists, that performed autopsies. And when I listened to the playback, I heard, I don't know if my microphone cut out or if I just misspoke, but I had said, and I quote, no respect to dermatologists, but it's not what they do. And what I meant to say was no disrespect to dermatologists. So it sounded like I was sort of saying no respect to dermatologists. That's not true. I love dermatologists. They do great work. The valedictorian of my med school class was a dermatologist. So I appreciate what they do. But I think they would also agree that it's a good thing that I'm doing the autopsies now and not them. All right, so now let's get into this episode today. I don't think it's going to be as long as the previous episode, but I did want to talk a little bit about history first. Now, I had made some proclamation in the first podcast about how I'm not going to talk a lot about history, and that's the truth. This is not a history podcast, but I've had feedback where people seem to love the historical elements, and perhaps I took it for granted that people knew a lot of that history. I feel like the stories that I know about pathology and autopsy and death are so well told, and they have been told so many times that I didn't feel they needed to be rehashed, but apparently people want to hear that. So I will try to add historical elements in when I can. And so what I wanted to do is since we're talking about corpses today, and really we're going to talk about autopsy, I wanted to talk about the history of autopsy really briefly, because there are books written on this, so I'm not going to go into too great a detail here. But autopsies have been done pretty much the same way in earnest for the last 200 years or so. They have decreased in frequency over that time, not only in America where I am, but of course overseas as well. Some of that is due to the increased volume of regular patient care, which kind of overwhelms those who are specialists in autopsy. And of course, I mentioned that there isn't a reimbursement for that procedure now in the hospital. So autopsy pathology was something that was very big in the 1800s and early 1900s, and an awful lot about what we know about modern disease and old diseases, of course, were gathered by those autopsy procedures. That's how doctors learned about how their patients lived and died. They learned about therapies, new surgical procedures. They would sometimes the patient would die, and they would have to do an autopsy and find out why. So it's really kind of a quality control measure, autopsy, where we see if treatments are working, we see if new therapies, new surgical therapies, and then of course new diseases. And of course we're in the midst of a new disease right now with the COVID-19 coronavirus pandemic, and there have been autopsy studies published. And I suspect that I will probably do a podcast on those findings, because this is essentially a brand new infection, a brand new virus that is causing a lot of problems in multiple organ systems. And although the pathologist and staff are at high risk for doing procedures on infectious diseases, new infectious diseases, it's something that's always been done. A lot of what we learned about HIV, in fact, was done at the autopsy table. And you have to really understand the nature of disease and to understand how that disease kills. You have to do an autopsy, and you have to look under the microscope and see on a cellular level, how is this disease causing problems? So, 200 years we've been doing that. Most of the medical books are written based a lot, at least the pathophysiology part, the pathology part, is based on autopsy. It's somewhat thought of as a forgotten procedure because, a lot of people they don't go to medical school to go perform autopsies. They don't want to be a pathologist. I think the number is 1 to 3% of people who enter medical school become pathologists. And I will talk at length at some point in the future why that is. There is some, misconceptions about the field for medical students when they come in. And also, there is kind of an anti-pathology bias. That sounds like I'm being a complainer, but I mean, anyone who's in pathology knows when you go through medical school, there's a little bit of a bias. When you say you're going into pathology, you'll have people say, oh, well, you're so good with your hands. Why don't you do surgery? Or you can talk to people. So why don't you become a family practice doctor? And I can talk at length about choosing a career, but ultimately, we choose the thing that we feel most comfortable and we feel best at. We feel that we can contribute to society and contribute to the advancement of medicine. And for some people, that's being a cardiac surgeon. For some people, that's being a autopsy pathologist. So, with that said, like I said, hasn't changed. The procedure hasn't changed that much in the last 200 years. But there was a big gap between the start of the millennium back in about 100 AD or so and 1500 AD. In fact, there was a guy, his name was Galen, Galen of Pergamum. Some of you have read about medical history and know about Galen, but what happened was Galen was a guy who did very few dissections on human beings. What he did was he dissected what's known as a Barbary ape, which is a kind of primate that's in the North Africa, Mediterranean region. He dissected apes. He also dissected pigs, and he deduced that the anatomy for humans was basically the same. And he's also one of the ancient physicians that's responsible for the humors method of pathology. And this goes back to the old bloodletting and things like that. Like, for instance, if you were depressed, you had too much bile, and it would be, that's why it was called melancholy. But because melon means dark and then chol means bile. So it was really not a scientific thing. It was kind of, this was his best guess on how the body worked from a physiologic perspective. And then his anatomy was based on animal anatomy. And so what was interesting is, Galen did this in 100, 200 AD, somewhere around in there. And then it just stuck and nobody questioned it, or maybe they questioned it. They probably got their heads lopped off or something if they questioned it. But basically medicine, the knowledge of medicine and anatomy and physiology remained virtually unchanged from the year 100 or 200 to about the year 1500. And then there was a renewed interest in the human body. You can imagine, and there are many reasons for this, and some of it has to do with the Roman Empire. There have been some people kind of say that the Catholic Church was responsible for suppressing dissection. There's different stories on that. Some say yes, and then there's actually some evidence that dissection was thought of as a good thing and was, scientific progress was not suppressed. Again, entire books have been written on that. But the important part to note is that without anybody questioning Galen for 1500 years, our understanding of medicine is 1,500 years behind at that point. And so I think on a bigger scope, that's why it's important as a scientist, as a human being, to question things. Um, it's one thing to come up with a conspiracy theory that has no basis, but if you have good logical thinking about why is this process the way it is, why is this not the way it should be, that's science. And eventually, Galen's findings, fell by the wayside, and they're found to be completely wrong. Actually, there was a guy in the 1500s, and his name was Andreas Vesalius. Okay, he was in Italy, and he is known today, and probably forevermore, as the father of anatomy. And that would be nice to have that kind of a title, wouldn't it? I don't think he ever really knew how maybe important that was, but he knew that he was doing good work because he was able to start dissecting real human corpses. And this guy not only did he do this, but he produced this incredible book which detailed all of the anatomical structures of the human body, and of course he saw lots of pathology as well. He was doing dissections on executed criminals because at the time that's what was legal, is for someone to be executed. This is different from what we talked about in the last episode with Burke and Hare, who were actually killing people in order to sell them for dissection. What Vesalius was doing was legal. And anyway, he produced a book called On the Fabric of the Human Body, and that is the English translation of the book. It's actually got an Italian name. But it's the point of that being he produced what is considered to be the greatest work in probably the history of anatomy. And it is incredibly illustrated as well. As many of you know, I'm very interested in art. I like to produce my own art. But Vesalius's book is incredible. If you Google it, you can see some of the images from the book. It's incredible. I would love to see a copy of that book someday. But you know, that's kind of, I think, where it kicked off for the modern medicine to get started was Vesalius. And then as we had all this understanding of anatomy and all this understanding, more understanding of physiology, we went from kind of the dark ages to that sort of Renaissance period where we were now understanding the body, and we were starting to, I guess the word would be demystify. It wasn't so much about evil spirits or too much bile or too little bile or things like that. They were found that there were concrete reasons for diseases, and that perhaps these diseases could be treated. So, from the mid 1500s all the way into the 1800s, when the really great work in medicine started with a German pathologist named Rudolph Verkau. If you've read that name before, you may have pronounced it Virchow. It's not Virchow, it's Verkau. And his name comes up a lot in medicine. He's not only an incredible physician, pathologist, but he was also an incredible guy. I mean, very interested in politics and advancement of public issues and things like that, and healthcare issues. So, and he was way ahead of his time. But anyway, Rudolph Verkau, he is the guy who started looking at tissues under the microscope. And he is the one who started to formulate the cellular basis of disease. Okay, and this is something I'm going to come back to over and over again as you listen to my podcast, and that is much of what occurs from a disease perspective begins inside of the cell, and that's why looking in the microscope at the tissues is so important, because we can see cellular changes there, which will portend or will indicate the disease process. And so Virchow in the 1800s was the guy who kind of set us on that track to where we are now. And so much of what we can do is now based on that. And so, looking under the microscope at tissues is something that's been done for a while. It is kind of a classic thing to do. Now the advancement of microscopy it's kind of gone in the molecular route. I shouldn't say that it's gone in the molecular route. It's heavily reliant on looking in the light microscope with your eyes and drawing conclusions. But there's also a lot of tests, immunohistochemical type tests, and also molecular type tests, which are really bringing this field into the 21st century and beyond. We'll talk about the future of pathology, both on that level and, of course, the autopsy level in future episodes. But ultimately, all of this comes down to scientific curiosity. That is really the basis of all of this, is not knowing something and then finding a way to get those answers. And so I, talked about, the first the autopsies that Vesalius did, and then some of these rudimentary dissections that Galen did. But, I like to think about like the first autopsy, the very first autopsy that was ever done. And that was probably done in prehistory. If you look through the records and you sort of study the literature, there are descriptions of postmortem exams and procedures of removing flesh and things like that in China and India from thousands of years ago. Even long before Galen was doing his thing right at the turn of the millennium there. But this is what I'm speaking of. And when I say first autopsy, is before any of this, before any written history. And I'm talking primitive man, because, if you think about it, if you think about primitive man, it doesn't really matter. I'm not going to speciate from an anthropological perspective and say it was Homo erectus or, Australopithecus or something like that. But the idea is that we have inherent in our minds, in our brain somewhere, the notion to become curious and to try to solve problems. At least, it seems that we do have that. I know today in this modern world, there is a high degree of what I would say is incuriousness, that people don't want to know why things happen, or maybe they just simply deny it happens altogether. But we would not be able to make progress in any fields were it not for this tendency to be curious. And so I've often mused about primitive man imagining what the first death was like that he witnessed, that he or she witnessed. You can imagine that tens of thousands of years ago, a lot of deaths would have been due to trauma. They would have been due to falling off cliffs, or maybe getting hit with a spear, or getting eaten by a bear or a tiger while trying to, get food or shelter. And that those cases, would be quite obvious. I mean, I think even to a primitive human being, if a tiger tears you apart, the cause of death is going to be, sharp force trauma. Well, I don't think they would say that, but that's quite obvious. What I'm talking about, though, is imagine a situation where I always picture kind of this primitive, prehistoric campfire, and people are sitting around it. Perhaps they're eating, and then one of them clutches his chest, falls over, and then the rest wonder what happened. And I always imagine that in that group was the first scientist, the first medical scientist, because somebody saw that happen, and they had to think more than just it happened. They had to think, why did that happen? This person was eating, maybe it was due to what he was eating. Maybe we shouldn't eat that anymore. But eventually someone decided to open the body. And of course, primitive man for a couple of million years has been using stone tools. Some of those tools quite sharp. Some of those tools used to remove meat from animals that they were killing. I would imagine that many times there were primitive autopsies where even obviously no medical training involved, you can tell that something went drastically wrong. For instance, if you, for someone who's had a ruptured aorta or ruptured heart, ruptured myocardium, the cause of death is obvious the moment you open the chest. And so I always feel kind of connected to that primitive level of curiosity when I do an autopsy. And that's why in this particular episode, I kind of wanted to recount for you my first autopsy. Now, I'm not going to go over every single solitary detail, although I do remember pretty much all of it. It had that kind of an aura to it that it just stuck with me. I mean, the lighting in the room, the degree of lighting, the everything that was on the walls. I mean, it's just crystallized for me. And I think that those most important impressionable moments in your life is something you'll always remember. And so what I wanted to do is I wanted to read something that I wrote for a magazine article, and it was about a decade ago actually, and it was about this very topic. The magazine article was called "To See for Oneself," and it was about the history of autopsy. And so, while I don't like to do scripted stuff mainly for these shows, I will occasionally do scripted stuff because I have done. I am somewhat of a, I guess you'd say, an amateur writer, and every now and then things are phrased just so, and I feel like that those scripted things could maybe tell the story a little bit better. So I want to read a very short passage from this article, just the intro, and kind of talk about this first autopsy. On a gray November morning during my pathology internship, I stood alone in the morgue of Indiana University Hospital amid the gentle buzzing of fluorescent lights and the steady drip of a faucet into a stainless steel sink. A recently deceased woman lay on the metal table, her skin pale yellow and smooth. She still wore earrings, a wedding ring, and makeup. Plastic tubes and IV lines protruded from her body, the last throes of medical intervention. With a sense of awe and excitement, I readied myself to perform the ancient ritual of autopsy. Although I had seen dying patients as a medical student, I had not been the lone person in a room with a dead body since dissecting a cadaver in my first year of medical school. There is the stillness of inactivity, and there is the manic stillness one experiences at these moments. Adrenaline amplified the physiologic responses of my body. I became aware of my breathing, the rushes of warm air crinkling my paper surgical mask, and the thumping of my heart as the pace increased. Although the body before me was now as unfeeling and inert as any other inanimate object in the room, I sensed the life this woman had lived. As a young wife, daughter, perhaps sister or mother, now mourned after a long battle with disease. I struggled to let go of my innate aversion to death, accept its finality, and separate the person from the body that remained. Focusing on my task, I performed the standard external examination, the pathologist's counterpart to the traditional physical exam a family doctor, internist, or surgeon might perform. While preparing my opening cut, I found a prominent grapefruit-sized lump where the shoulder meets the upper chest. I steadied my hand and pressed the blade against the skin, puncturing the epidermis and the deep soft tissue until the scalpel hit bone. The skin retained enough elasticity to recoil from my blade, and I quickly completed the series of cuts to create a Y-shaped incision on the chest and abdomen. I examined the tissues of the chest wall, which revealed a fleshy mass of disorganized white tissue that extended from within the breast into the underlying skeletal muscle and ribs with an implacable grip. This was the nature of cancer, perfectly illustrating the etymology of the word from carcinos, meaning crab. The name was coined by the great Greek physician Hippocrates, based on the tendency of infiltrative malignant tumors to spread in a stellate finger-like projections that resembled a crab's legs and claws. The word autopsy, from the Greek meaning to see for oneself, expressed my experience here, developing my understanding of malignant tumors with my own eyes, a skill I would cultivate for the remainder of my career as a pathologist. It was a humbling episode to see such a personal, flagrant, and advanced display of this illness in a woman of my own age. I felt honored to be the only one to lay eyes and hands on the very substance of the disease that had brought this woman to her death. I also felt a sense of connection with the physicians of eras long past who took the leap from merely observing the surface of a body to seeing what was within. Such discovery is the purest form of medicine when when a clinical condition can be directly linked to observed physical manifestations. So that was the opening incision of my first autopsy. I was, you know, it was just a little bit overwhelming. I mean, I was a little nervous. It wasn't too bad. Um, I had been primed that it was coming because during my first year of residency, I was on call for autopsies during November, and several days had passed without one, so I knew that it was coming. Although hospital autopsies have decreased over the years, when you work at a university medical center, you're going to get several a month usually. And so I remember one morning as I was still in my apartment, not quite to work yet, my pager went off, and I knew what that meant. I knew I was finally going to get to do that first autopsy. And so I went to work, and we have like a morning meeting that we did, and then down to the morgue. And so I went into the morgue, and I was expecting there to be a procedure where we get the body out, and it takes 25 minutes to do. But instead, the body was already out. It was laying there. Body bag was open. The body was unclothed. She was just laying there on the table, and the diener had already pulled her out and had her ready for me. Now, diener, let me take a moment to explain that. Diener is a term which is another name for an autopsy technician or a morgue technician. And it's not, I think the term is falling out of favor a little bit. It's from a German word, Leichendiener. I hope I pronounced that right, although without the proper German accent. I didn't want to show off. So that actually meant corpse servant or morgue servant. So it was like a servant of the dead. It was an old term. And again, much of the work in pathology were done by German pathologists, Rudolph Verkau and a guy named Rokitansky. They did like over 100,000 autopsies, I think, in their career combined. And so a lot of these words have German origins. So the diener is a word that kind of made its way into regular use. And as an aside, and more related to some of the cultural things that are happening now, it was a term I always used, diener. And when I did my forensics fellowship, I was trained by an African American lady, forensic pathologist, and one of my first meetings with her, I had talked about, well, where are your dieners? Can I meet your dieners? And she pointed out to me that that is not a term that she likes very well, because the word diener means servant, and so there was like an implied servitude, and so I think they're trying to go away from that term. Although all of the dieners I had worked with were African American, and they were fine with that term, but I understand that there's some culturally sensitive terms maybe which are falling out of favor. So I guess just if you're working in a morgue, find out if people find that term acceptable or not. I think I use the term now autopsy assistant, sometimes forensic autopsy assistant. But just wanted to take an aside there to talk about the diener. Sorry. But anyway, so the diener had pulled out, and of course not diener, but autopsy assistant had pulled out the body, and I just stood there alone in the morgue with her. He wasn't there yet, or he had been there and left, and I just had time to kind of stand and look at her. And it was rather amazing because, I mean, she really looked like she was just asleep. And that's because this body, as I had looked at the chart, this body had died only a few hours before. And, I even started my external examination, which is part of the autopsy exam which is dedicated to just noting whether or not there's medical intervention, noting hair color, eye color, presence of injuries, or obvious signs of disease. She had a very obvious sign of disease, this obvious huge tumor on her chest. And as I did the exam, I could tell she was warm. I could touch, because I touched her body to look at her fingernails and to look inside of her eyes and things like that. And she was still quite warm. And it takes a while for a body to cool down after death. We'll talk about changes after death, but usually it's about a degree Fahrenheit per hour. She had been 4 hours. But there's also some bodies, particularly if they have fever before death, the temperature will not go down as quickly, or sometimes due to the action of bacterial metabolism, the temperature will actually increase. So yes, it's true. A body can be dead and still kind of have a little bit of a fever for a little bit, and then the temperature starts to drop off. So I'm not sure she had been in the cooler at all. I think maybe they brought her straight from the ward down. Well, that did increase the anxiety a little bit, because unlike the cadaver, which was hard and firm and gray and cold and had been in formaldehyde for 6 months, this person was breathing 4 hours ago, presumably. So that first incision was probably one of the most anxiety provoking moments of my career. And, I took the scalpel, and once he came in and we were all set to go, I wanted to make sure that I did the opening incision. In many cases, autopsy assistants at universities will perform the whole procedure. Sometimes in forensics as well, they'll do the whole procedure. So I wanted to make sure that I got that opening incision under my belt. And unlike the opening incision, if you remember my description of the cadaver, the knife just sunk into it without any response. You couldn't even see the skin split on the cadaver. But in this case, her skin still had a lot of elasticity. And so as soon as you put the blade in, it split. It just split open and recoiled, jumped back from the blade. And thankfully she didn't move. I think that was my biggest concern, was what she was going to do. But the autopsy itself, he did part of it, I did part of it. And for most of the time, I think I was just observing. It was just such a surreal experience to have this warm body that, you have your hands on, and then suddenly you have your hands in. And you're literally taking the heart out, taking the lungs or the bowels and kidneys. And there's really two parts that stood out to me. And of course, we'll talk in great detail. I mean, by the time you finish this podcast series, whenever it ends, you will have a very good idea of how an autopsy happens and what it looks like. When you take the Y-shaped incision of the chest, what happens is you actually reflect the top part of the Y, which is the top part of the chest where, if you imagine your chest where a necklace would be, that actually is reflected back over the face. So you dissect that tissue back, because then it gives you access to the neck, so the larynx. It gives you access to the clavicles and the top of the rib cage, because you have to take the ribs and the sternum off. And so it was so unusual to see this human body, which just moments before looked like a sleeping woman, to now have this flap of flesh, bright red skeletal muscle, bright yellow fat, just covering her face. It was just part of the procedure. There's nothing disrespectful about it, but that is the nature of it. And so that visual stuck to me. But most unusual was the opening of the head. That's the one where you kind of never forget the first time you see a human head opened. So basically what happens is to open a head, you take the scalpel behind the ear, and if you feel behind your ear, you can feel a bony prominence. It's called the mastoid. And you do what's called a bimastoidal incision. So you put the knife all the way down to the mastoid, and you go up over the top of the head to the other mastoid behind the other ear. And then you dissect the tissue away from the skull. Usually you can do that with your hands. You don't need to do it with a knife unless it's really tough. And you dissect that tissue away, and then you simply fold the flap over the face. And so now that's a very unusual thing, because all of a sudden, you see this particular woman had like a lot of blonde hair, and it had been styled, and then once we decided to open the head, the part he actually did, I was just observing because I had never done that before. Um, then all of a sudden you don't see any hair, and it's flipped over the face, the entire scalp, and then the skull is exposed, bright, kind of whitish tan bone, and you can see the sutures of where the bony plates of the skull are fused together. You can see the temporalis muscles on the side of the head, and it is definitely an unusual thing to witness. But then comes the sights and sounds part. That's the sights part. The sounds probably most unusual. The bone saw, of course, opens the skull. There are many different ways to do this, so I'm not going to talk shop on techniques. But the point is, the top of the skull is called the calvarium, and you have to saw through that with a what's called a striker saw, or there are different types of saws. And then you have to insert a skull key. It's called, some people call it a skull key, and it's really a T-shaped piece of metal that you put in your hand. It almost like you would do with a wine cork. But anyway, you put the skull key in the groove that you've cut with the saw, and you turn it. You literally turn it like a key, and the pop sound that it makes when the calvarium is liberated is very unusual. You'll never forget that. And then, of course, what happens is that the skull, top of the skull doesn't usually just pop off. It's actually attached to part of the dura. The dura mater is the lining of the brain, and the outside of it serves as the periosteum, or the lining of the inside of the skull. So then you have to pull the calvarium back, and it produces this like ripping, sucking type sound. And so, at that point, there was some, I think, shock on my part, because I really didn't know how a head was opened. But that made an impression on me. And of course, now I do it all week, every week, and I don't even think about it twice. But the first time you do it, it's pretty stunning. I've been meaning to put up a series of dissection type videos on my Instagram and or YouTube, but how the pandemic has caused a problem, because I don't want to set up camera equipment or get up my phone out and start filming and things like that when we may have potential, COVID air, dust coming off of bone saws and things like that. So hopefully, if things get a little more in line for this pandemic, and it, hopefully goes away at some point, or we somehow find a way to get past it, then I'll start to produce more of those videos. That was going to be one of my aims for 2020, was producing more dissection videos. But you'll get to see a nice professional looking removal of the skull and many other parts of the body of the autopsy. That will be kind of a second part of what you're listening to now. You're hearing the verbal part, and then you'll be able to watch the visual part. So, there's a lot I could say about the first autopsy of my own, but I think that covers it pretty well. I know this will probably generate a lot of questions, but ultimately, it all goes back to that scientific curiosity that I talked about. You're kind of in awe and horrified at the same time when you do your first autopsy. And, to me, the autopsy is the clearest expression of scientific curiosity in medicine. If you think about, Newton had his apple, but the medical examiner has the corpse. And at its root, this process and this podcast and everything we talk about is all about scientific endeavor. I mean, as we've gone over many times, the word autopsy means to see for oneself. And so it is, in a sense, about obtaining a form of truth. Sometimes it's to see for oneself, but also another translation of that word is to see oneself. Because when you do an autopsy, you're also seeing what you look like on the inside. And you also muse about, well, what diseases might I have that I don't know about? And so, that's, I think, why I like forensic pathology so much in this form of medicine, is that it's so scientific at its core. It's all about obtaining truth through making observations and then drawing logical conclusions based on that. Because, that the truth doesn't always come in the form of facts, but I find it comforting when it does. I could talk a lot about the nature of truth. I think in some ways truth is being made to be subjective in the scientific realms. That we should in fact always question science. But if science can produce the backup, can produce or can have reproducible results, and the data is good, then your ability to assail it goes away. And so I think that truth can be related to emotional things. For instance, you might know that you love somebody, but you can't prove that objectively, but you know it in your heart. Well, I'm in the business of finding things objectively and observing with my own eyes and producing results based on those facts. And so I feel like if your truth is not based in some realm on facts, then ultimately your truth will be based on opinion or emotions. And there is a place for that, but not in the scientific realm. So I hope to talk more about the nature of science, the nature as it relates to forensic pathology, because ultimately that's why I'm in this. And I think that ultimately that's why you listen. Whether or not you want to go into forensics, you have the curiosity. And it's the morbid curiosity about death. And it's the morbid curiosity about how things work that maybe you don't have an intimate knowledge with. But I hope to provide for you a conduit to obtain that knowledge and to show you how I think and how scientists and medical scientists think and how we arrive at the conclusions that we arrive at. And so, with that, I think that is pretty much sums up the episode of Corpses and Cadavers, Part 2. If you have any questions, of course, I'll try to answer them. Most of you know my Instagram, which is at Anatomy and the Dead. There's an underscore in between each word. And I have a YouTube channel under the same name, and there are various ways to find me. But for the most part, I hope you enjoyed this, and then we will be back with another episode, although I'm not releasing the title of that just yet. We'll see what happens and what the ether dictates for me to put in as the next episode.